Good afternoon, everyone. Welcome to the Injury Prevention Research Center at Emory's webinar on teen driving safety, community resources, tools, and safety measures. I am Sharon Nieb, iPrice Program Director, and I will be your host and moderator for the webinar. iPrice is a CDC-funded injury prevention research center, and our goal is to reduce the top causes of injury and injury death in Georgia and the Southeast through impactful research, education, and outreach. Before we begin with the discussion, I want to let you know this webinar is being recorded and will be made available on our website and social media platforms. Also, this activity has been approved for 1 contact hour of continuing nursing education. Presentation in its entirety and complete the course evaluation in order to receive continuing education credit. Continuing education credit will be provided through the Georgia Department of Public Health. The Georgia Department of Public Health is an approved provider of continuing nursing education by the Alabama Nurses State Association, an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. No influential financial relationships have been disclosed by the planners or presenters, which would influence the planning of this activity. No commercial support has influenced the planning of the educational objectives and content of this activity. Below is the link for the course evaluation. Now, I would like to introduce the members of the panel. Katie Curtis. Ms. Katie Curtis is the grant manager with the Georgia Governor's Office of Highway Safety. Welcome, Ms. Curtis.
Hi, thank you for having me.
Great. Ms. Kaylee Robinson is currently the program specialist for Mothers Against Drunk Driving Georgia. Welcome, Ms. Robinson.
Good afternoon, all.
Ms. Stacey Tisdale is an associate transportation researcher at the Texas A&M Transportation Research Institute in the Youth Safety Program. Welcome, Ms. Tisdale.
Hey everyone, glad to be here.
Ms. Emma Harrington is the Director of Injury Prevention and Education Services at the Shepherd Center, which is located in Atlanta, Georgia. Welcome, Ms. Harrington.
Thanks so much, glad to be here.
Before we get started, I would like to go over the format of the webinar. The panel is going to provide a 20-minute presentation which will be followed by questions to the individual panel members. We also plan to save 15 minutes at the end of the webinar for the panel to answer questions submitted by the audience. Your mics will be muted throughout the webinar, so please submit your questions through the chat box. Now, let's get started with the panel's presentation.
Well, hello everyone. Like she said, I'm Katie Curtis. I'm the Young Adult Grant Manager for the Governor's Office of Highway Safety. The mission of GOHS is to educate the public on highway safety and facilitate the implementation of programs that reduce crashes, injuries, and fatalities on our roadways. One of the ways that we do this is through our young adult programs. For our high school students, we have a program called SAD. SAD began in 1981. You might have known them as Students Against Drunk Driving, but now SAD stands for Students Against Destructive Decisions. They're the nation's premier youth health and safety organization, and it empowers young people with tools and resources needed to confront the risks and pressures they face every day, including substance abuse, impaired and distracted driving, mental health issues, and much more. Through informed programming and a national peer-to-peer network, SAD is shaping young people into leaders and advocates for our youth health and safety in their schools and communities. So with that, GOHS works with high school students across Georgia to fund chapter grants up to $6,500. These grants are based on some of the initiatives seen here, These objectives include holding a monthly meeting, establishing chapter officers, participating in SAD campaigns, holding a seatbelt check at school, all to really help combat those destructive decisions. Many high schools already have programming around prom or graduation, but by establishing a SAD chapter, those prevention programs can continue on throughout the year and be assisted monetarily through the grant funds. Our grant begins October 1st and runs through September 30th, and usually has applications open around January. You can find that information on our website. The grant funds really help the students put on programs within their schools and allows them, one of the really cool things is allows them to travel to SAD national conferences that are held in different locations every year. The other grant program that is housed within GOHS is our college program or our young adult program. This program is providing funding to colleges across Georgia to promote education and awareness to young adults about highway safety issues. Again, things like the underage drinking, impaired driving, destructive decisions, and other high-risk behaviors, really in order to decrease those crashes, injuries, and fatalities that we talked about. That grant, if you'll go to the next slide, that grant focuses primarily on the use of peer health educators and programming on campuses to combat the risky behaviors seen on college campuses through drinking and drugs. Overall, both SAD and YA and GOHS, those programs are here to make sure that your youth and students across Georgia are getting the resources that they need and the education that they need to make those informed decisions, ultimately to make our roadways much more safe.
All right, thank you, Katie. Mothers Against Drunk Driving, I am the program specialist for MAD Georgia, and I want to show this video to show you about MAD's mission and what we do in the community.
At MAD, we believe in zero. Zero fathers who aren't there for bedtime. Zero mothers who miss the first day of kindergarten. Zero sons and daughters who never come home. We believe in zero victims of drunk driving. Since MAD's founding, we've made great progress. Drunk driving fatalities declined by more than 50%. All 50 states raised the legal drinking age to 21 and made it illegal for adults to drive with a blood alcohol concentration at or above 0.08. And as of 2016, over half of the country is covered by all offender ignition interlock laws. This is all good news, but it's not good enough. It's not good enough because every year, drunk driving injures 290,000 people. It's not good enough because every year drunk driving takes 10,000 lives. It's not good enough because it isn't zero. But we know that we can get to zero, and it starts with you. When you work with MAD, you're part of the campaign to eliminate drunk driving. The campaign has 4 initiatives. 1, support more high-visibility law enforcement. If people think they'll be caught, they're less likely to drive after drinking. DUI checkpoints can reduce drunk driving deaths by 17% and are one of the strongest deterrents to drunk driving currently available to law enforcement. 2, ignition interlocks for all convicted drunk drivers. Ignition interlocks force offenders to provide a sober breath sample before operating their vehicles. This keeps drunk drivers off of the road and reduces repeat DUI offenses by 67%. If ignition interlocks were adopted nationwide, an estimated 1,000 additional lives could be saved each year. 3, advanced vehicle technology. This is the future of a world without drunk driving. The driver alcohol detection system for safety will use breath and/or touch sensors inside the vehicle to determine if a driver is over the BAC limit of 0.08 and keep the car from moving. Additionally, autonomous vehicle technologies have the potential to eliminate many types of roadway fatalities, including drunk driving. If universally adopted, no more victims will become a reality. 4, public support. Everyone has a responsibility to help eliminate drunk driving. Thanks to non-drinking designated drivers, taxis, public transportation, and ride-sharing apps, there's no excuse to drive drunk. And buckle up every time. Wearing a seatbelt is the best defense against a drunk driver. When you support MAD and the campaign to eliminate drunk driving, your time, your financial support, your energy will all add up to zero. Because we believe in a hug on the first day of school. We believe in another bedtime story. We believe in no more victims. We believe in zero.
Definitely.
At MAD.
I want to talk a little bit about two different programs that we offer to the community. It's called Power Parents, which is an evidence-based program to introduce for parents and guardians and leaders and nurses to introduce a conversation about the dangers of drinking and driving. But we also have another program. It's called Power of Youth, and this is our I guess school age or middle and high school curriculum that we talk to young people during Red Ribbon Week. Health teachers can actually get trained in this curriculum as well. So if you want more information, go to mad.org to learn about our programs. Thank you today. Tracy.
Hey everyone again. My name is Stacey Tisdale and I'm with Texas A&M Transportation Institute. And we have a youth transportation program which includes teens in the driver's seat. So I'm going to tell you a little bit about the program and then talk about the top risks teens face behind the wheel. Teens in the driver's seat, it's a peer-to-peer teen safe driving program that's available at no cost to public, private, middle, and high schools in Georgia. We work directly with teen groups such as SAD groups to give them the resources, information, and materials to help combat teen crashes among their peers. The idea is for the team to do the messaging and activities in their school in order to create a safer driving culture using positive peer pressure. We have found that if a team can continuously conduct safe driving messages and engaging activities, safe driving can actually become the norm in a community. We are sponsored in Georgia through GDOT and General Motors, and also partnered with Safe Kids Georgia, utilizing their network of coordinators across the state to be our local representatives. We have received several national awards, including being recognized as a national best practice by the National Highway Traffic Safety Administration, and we're also a certified peer program. And you go ahead and flip to the next slide. Okay, sorry about the text mess up on there. So what you see here are the top driving risks. It's important to note that all of these actually come after the greatest risk, which is inexperience. The TDS program covers all of these risks. Some of these you're probably very familiar with, but others may not be as familiar to you. So I'm going to say a few things about each of them. Distractions has risen to the top risk over the last few years, which you're probably very well aware of. Mainly we think of cell phones, but it can be anything that takes the driver's mind, eyes, or hands off the wheel and off the task of driving. So contrary to what our laws say, talking hands-free is still not safe. That can still put a driver 4 times at risk of a crash. For teens, it is not only texting, but also think of social media, photos and videos, things like that with their cell phone behind the wheel. Additionally, a huge distraction for teens is other passengers, especially other teens. This includes their siblings, which is legal for a new driver. More fatal teen crashes occur when passengers are in the car, and crash risk increases with each additional passenger. Over 53% of teens who died as passengers were driven by other teens, and that was in 2017. Nighttime and drowsy driving, is a huge issue among teens. 58% of teen crash deaths occur between the hours of 6 p.m. and 6 a.m. This is due to visibility challenges, slower response time from fatigue, and the lack of experience, again, driving in these conditions. So research suggests that teens should have about 8 to 10 hours of sleep each night, If you have any teens in your life, you can probably attest to that that just doesn't happen. And one study found that only 15% reported sleeping 8.5 hours on school nights. What we have found is that students get about 7.4 hours of sleep at night. So by the end of the week, when they're ready to go out, that's when the crashes start going up. Speeding, another commonly known one. Teens do not consider driving 5 to 10 miles above the speed limit to be dangerous, and that has become very much a part of our culture also, right? And they're also more likely to tailgate. Speeding has been found to be more prevalent among teenagers who reported more risky friends, especially among those who reported lower perceived risk for risky driving. So if they don't believe driving is risky, they're going to take the risks, right? Teens with exclusive access to a vehicle were more likely to speed than those who shared a vehicle. Seatbelts, it's a given for most of us. Roughly 2 out of 4 teens, drivers, and passengers involved in fatal crashes were not wearing a seatbelt. Teen drivers are more likely to be buckled up than teen passengers. A seatbelt must be worn properly, of course, to be most effective. So across the chest and across the hips. A lot of times you see teens taking shortcuts. If they have it on, it may be behind their chest. Their seat may be laid back too much or feet up on the dash, that sort of thing. We do have a seatbelt data collection activity and have found that at new activity schools, so schools that have done it for the first year, teen drivers have about an 80% usage rate, while teen passengers have about a 66% usage rate. If these schools continue to provide good seatbelt messaging, we've seen those numbers rise above 92% and about 85% respectively. Finally, impaired driving for teens can just as likely mean driving under the influence of marijuana as it does alcohol. Drug driving is increasing while drunk driving is decreasing among teens, with marijuana being the most commonly found drug. As perceptions and social acceptances change, we expect this to increase. Young drivers are less likely to drive after drinking, but more likely to crash. This is especially true at low and moderate BAC, so blood alcohol content. They are also less likely to buckle up. And just to remind you guys, zero tolerance laws are nationwide, which means it's illegal for a teen driver to have any traceable amount of alcohol in their system. Teens need to know that a DUI cannot be only very expensive for their families, but also result in lost academic eligibility, scholarships, and possible future job opportunities. What is important to remember for all of these risks, that they are preventable. And when a teen engages in one or more, it is especially dangerous because you have to remember there's still those inexperienced drivers. Also, as we're coming up on summer, remember that we're entering into those 100 deadliest days of summer where crashes start going up. And even in this time, we really expect to see that to happen again. And then last slide, please. So finally, here are some things that TDS can offer to program schools. We are very incentive-based. We believe in positive messaging and encouraging friends to keep friends safe. We want everything to be teen-centric and ask our teen advisory board to review and give feedback on the materials that are produced. We also have a poster and video contest each year, and entries are utilized in all sorts of ways. I'll close this section by saying that if you've been a school nurse for any amount of time, you've probably known some teens that have been injured or even killed in car crashes. You know the impact it has on a school and in a community. So I will say that even if your school does not start TDS, you are more than welcome to use and share our resources. We have a robust website and some great social media pages, and anything that is posted can be shared, and we actually encourage it. So our website is t-driver.com, and our social media handle is @teensdriverseat, and that's for Facebook, Instagram, and Twitter. So thank you very much.
Perfect. So this is Emma Harrington. I'm from the Shepherd Center. We're a catastrophic injury hospital. We do brain and spinal cord injury. And we unfortunately have an entire floor dedicated to adolescents who, for the most part, are coming in due to motor vehicle crashes. So we wondered as a hospital, what can we do about this? How can we help prevent these crashes that are really devastating to family and friends? So we did something a little out of the box. We got a lot of funding from the Governor's Office of Highway Safety, and they believed in us to create an app. So it's a little different. It's an app that is created for parents, not for the teenagers. And it's to guide the parent through the entire process of teaching your teenager how to drive. It's a daunting task, something we all know. But at Shepherd Center, we have very specific experts on staff. We have a whole driving clinic, and these are the guys and gals that are responsible for getting our patients back to driving if at all possible. So they helped write a curriculum. It's called Auto Coach. It's available nationwide, and it's a free download. If you could skip to the next slide, please. So some of the features of our app, I think the feature that parents most appreciate is that it tracks the hours that your teen is meant to drive. So generally, it's about 40 hours, 50 hours, depending on the state. And when you log into the app and sign up, there'll be a drop-down menu and you can pick your state. And this is really to ensure that you actually do all of those hours behind the wheel with your child. It's a lot of time spent together with what can be moody teenagers. So it's super important that those hours get done. It's part of this whole modeling and monitoring the process. The more experience your teenager has, the safer your teenager will be. It also educates the parents. This is a large piece of it. Parent that goes through the app. And each parent that signs up for the app goes through a test, a 5-question quiz that talks about what are called GDLs, the graduated driver's licensing laws in each state. So it's how many kids can your own teenager have in their car? What are the hours that they can drive? All of that to really make the parent aware of the laws surrounding their new teen driver. It's applicable in all 50 states, a free download. And we also really wanted to target those risky behaviors that happen for the parents as well. We want you to model an appropriate driving behavior. And we know that teenagers watch how we drive just as soon as that car seat gets turned around. Please excuse the chihuahuas in the back. We also have an entire skill acquisition list. And that it really targets all the things that we see people come in for to Shepherd Center. So the overcorrecting, the speeding, the properly scanning. So we are hoping that this app is kind of an all-encompassing app to really help you through that process of modeling and monitoring the entire really journey of getting your teen on the road and keeping them safe. The more practice they have, the better, and the better off you will be as well. So I just saw in the chat box there, my name is Emma Harrington. I'm from Shepherd Center. And that's just about it. Thank you.
Thank you, Emma. I am going to ask you, we did have someone ask, what is the name of the app? So if you could repeat that again. Probably yes. When that phone went off, which was mine, I apologize. Probably people did not hear that. So
no problem. It's called Auto Coach, and it's one word, and it's available for free in the App Store. One thing I forgot to mention is that there's 10 chapters of content that drive essentially you through the very basics of driving with your teenager, how to turn on the lights, how to change the oil, to the far more intensive maneuvers, driving around big trucks, highway driving, merging, that sort of thing. And we've also added 12 chapters for cognitive and physical disabilities. Everything we do at Shepherd Center, we aim to have it be accessible. And this was our attempt to make it accessible for every teen learning how to drive.
Thank you very much. That was very informative. I want to thank all the panelists for their part of the presentation. Very, very informative. So now we're going to go to individual questions for each panelist. And the first question is for Ms. Tisdale. How can schools get involved with teens in the driver's seat?
Well, it's actually very easy, and I'll let you in on a little hint. We still have supplies for Georgia schools because with the shutdown, everything went, screeching to a halt.
Right.
And so, yeah, and so if you guys know a team of teens that can do this program, and great ones to tap into are like if you have SAD on campus, FCCLA, National Honor Society, anything where teens have an organization and they need a project to do, we can fill that. So all they have to do is just get on our website. There's an order form on there. We are still taking orders. If you're prepping for next year, go ahead and order, and you can go ahead and get a jump start on planning for next year. And it is completely free, and it's just one piece of paper, or actually one form that you have to fill out online.
Oh, that sounds like a great resource. Great resource. Thank you. Thank you very much. Okay, so the second question is for Ms. Harrington. How does the Auto Coach app help parents model and monitor the teen driving process? So how does that help them model the teen driving process?
Right. So we want the parent to read the content of each curriculum and each chapter before they get on the road with their teenager, ensuring that they know exactly what to teach their teenager and when. So they're hitting all the skills that they need to learn to stay safe on the road, so that there's a confidence there that they have actually imparted on them all of the knowledge that they will actually need.
Thank you, Emma. Thank you very much. And so then question 3 goes to Ms. Robinson. How can MAD provide services to the youth in your area?
Definitely. We have a evidence-based curriculum. It's called The Power of Youth, just my little baby. I go out to 168 counties throughout Georgia, absolutely free. It starts in middle school. Health teachers can definitely invite us in during Red Ribbon Week. And then we also do a high school program for pre-prom. Prom season is always, kids on their own. Okay, now we're telling them how to skill set, how to deal with peer pressure, and saying no to drugs, and 21 is a legal drinking age. So Power of Youth is our evidence-based program for young people throughout the nation in all 50 states. And now we're in Guam, Hawaii, and Brazil. So I actually volunteer for Brazil, so sign me up. So this is a great program, and it's absolutely free. Health teachers can get trained in the curriculum for Power Parents, and we can reach out to your MAD chapters to invite us into your schools.
So I'm going to add one question to that, Kaylee. How do they order this?
Right, so you go to, definitely, mad.org, they have MAD Georgia has a request form for me to come out to your area. And pretty much my calendar year was pretty much booked for pre-prom events all the way to May 26th, but we're wide open right now. We're doing everything virtual, so we can actually, we actually have a summer enrichment program that we're offering to the community every Tuesday at 10 o'clock. So I'm gonna forward that flyer to you. And Emma's a part of that. The Shepherd Center will be talking about that. GDOT will be. So every week we'll have a series of prevention. And so it's our Power of Youth evidence-based programs on how to talk to dangers about drinking and driving and drug use prevention. So you can definitely get that flyer to participants. Probably tomorrow we'll have our Zoom link on that. It's actually an hour of curriculum, and it's absolutely free. Power of Youth. So go to
Thank you.
And request the request form for me to come out. We do virtual Zoom presentations currently right now.
That sounds very interesting. It sounds like a lot of great resources so far for our school nurses. That's great. So the fourth question goes to Ms. Curtis. How will becoming a youth program grantee help your school base, your student base, excuse me?
Well, by establishing SAD chapters and potentially if you have a college program as well, you're really letting the students take the lead on their own prevention messaging. I know sometimes we struggle to remain relevant to students and youth, especially as the culture shifts and changes. So the peer-to-peer education model really allows that student to take the initiative and given, of course, using the given resources that they have. So they're creating the programs that are relevant and forward thinking for their students. The grant money does provide the monetary backing needed for the schools to get on board as well. So like I said, it's the $6,500 grant to our SAD schools. So that's really, it just gives the students an organization that they can be a part of that's really doing nothing but help shape their future and allowing them to kick those destructive behaviors now. So it really helps them become better drivers and better citizens in the future as well.
That's great. Thank you so much for answering that question. So now I am going to go to doing a couple of questions for the entire group. And this first question has been it's a very interesting question to me. And I want to get your perspective on it. Since we have this panel of experts in front of us, I really like to get your perspective. So right now in Georgia, new drivers are not being road tested before receiving their license. Some teens, since teens will have until September 30th to make up their road test, what messaging can we provide to parents to encourage their involvement after their teen is already licensed but not yet road tested?
I'll start that. So parents are going to be key on this, and especially utilizing things like Auto Coach, the app, in making sure that their teen gets what we recommend is at least 50 hours behind the wheel in all conditions. So, you know, a lot of times, you know, it's kind of scary for parents to go out driving with their kid. And I will tell you also that even if you send them to a driving school, they're not going to have 50 hours behind the wheel when they leave that driving school. So it's really, they still need the practice. And even after they get their license, check in with them, you know, don't let them loose. I know that license, you know, says that they're legal to drive, but again, they're inexperienced. They develop very bad habits within about 6 months of getting behind the wheel because they start feeling a lot more comfortable, and they may pick up the phone, they may start speeding a little bit. So you want to hop back in that car with them and just see, you know, what's going on. And if they get in any crashes, any tickets or anything like that, that's a red flag, because something's not going on that should be. And so maybe some of those safe driving practices have kind of gone out the window.
I would also add to take advantage of the roads right now, especially with, I guess, Atlanta being a little less populated on our roadways. I know with schools being out and jobs being teleworking, the roadways are a little less populated. So get out and drive. You can social distance in the car together, but really just getting that practice of merging onto 75 and 285 and 20 and all of the big ones. Drive around the state. Take advantage of this time, especially.
That's true.
You know, Matt has a parent-teen agreement form, and it gives you like certain bullet points that the parent can adjust. Is Adobe, so you can adjust what your agreement is like. Is there a curfew? What is it, you know, the driving speed? If you have one ticket, you know, or citation, no seatbelts, things like that the parents can actually put in there. So it holds the new driver, it's what a quote unquote teen, accountable. And so once those things happen, you can definitely come back to the table and say, okay, well, did we follow these rules that we both agreed on and we both signed? So it holds the young adult accountable and learning about traffic safety.
Absolutely. Any other comments? Any other comments on this question? Great advice. Absolutely fantastic advice. So the second question I have for you is, how do you make prevention messaging break through the cluttered messaging already aimed towards youth?
Well, I'll start, I guess. I think right now, and everybody's just being inundated with social media messaging, because we're not being able to go out to the schools and have our prom events, like Haley was saying, and have our graduation events. So it's breaking through and making sure you're posting. TDS does a great job of this, making sure they're posting at the right times, making sure you're posting relevant information. And another thing that I love to do is exactly like if you have a baby, you hide the medicine in the scrambled eggs. Try and do that with some prevention messaging. Do something else, maybe a trivia night or something else that is to everybody and can have some prevention messaging, but isn't just prevention based. It's not come have a teen driver safety trivia night. It's maybe a general trivia night that also has some GDL licensing laws questions thrown in there. That would be my suggestion, is really try and focus on thinking outside of the box and being really creative with your social messaging right now.
Definitely, Kate. You know, one thing I realized is that there has always been a panic situation going on in the world. I have a 9/11 baby, so she is graduating this year, and you know, I just have to let her know that this is just one of the bullet points of what you're going to go through in life. But still, you know, we still have to have the conversation of, you know, if you go to college in the fall, you still have to wear your seatbelt, you still have to slow down, you know, 21, still the legal drinking age, you know, things like that. So we still have to be combative of sharing our safety conversation along with what's currently going on in the world right now. Maybe not as if, you know, every day you put your seatbelt on, you know, just drive 65, drive speed limit. We have to meet them where they are. And so our evidence-based curriculum, I love this program, gives you tools on how to talk to your young people about anything. You can replace underage drinking with how was your day, social media, you know, social distancing in your room, or what's your plans for, you know, COVID, you know, 19, you know, so we can have those conversations and meet them where they are.
I'll also
Go ahead, I'm sorry.
No, sorry. Really quickly, is that, you know, the messaging, if you do a peer-to-peer program, or, you know, the messaging needs to come from the teens. And as long as they have the good information, resources, and that training to know what the message should be and make sure there's learning in there, then let them frame that however they feel, you know, is best. We know that teens influence, you know, what other teens eat, what they wear, what music they listen to, so they can really, you know, also provide positive peer pressure to do good things. And so teen driving, teen safe driving is one of those. Having a teen tell another teen to put your phone down, however they want to say it, you know, to make it fit for that situation and that teen, then that's fine. But as long as they're the one that's saying it.
Great, great. Any other comments on that? Well, thank you for an interesting discussion. And Ashley, do we have some questions in the chat box?
Yes, we have a few questions in the chat box. I'll start with the first one. This question says, are there any initiatives involving pediatric or primary care service practices?
Not that I'm aware of. Ladies?
I was going to say occupant protection laws are what we focus when we think of primary care initiatives. We're mostly concerned that they're following the laws with their seatbelts and their car seats and things like that. But it's just like Emma said, that the minute that those kids turn around in the car seat, they're watching you drive. So you are the best influence.
Right. I know the seatbelt laws and the you know, child occupancy laws, as far as having car seats and the types of car seats, are very important and are focused on in our pediatric practices very much. But I think it's a very good question, because we still have teens that use pediatricians, and so you know, this could be a possible new thought as far as getting some of that information into a pediatrician's hands. Any of you'd like to comment on that?
Well, we have a few more questions in the chat box, about 3 or 4 more questions.
Right.
So the next question is, can you use the Auto Coach app for multiple teens learning to drive at the same time?
Yes, you definitely can. And whoever's teaching the teenager how to drive, in my case, my mother could not handle the stress, so it was all my dad. But if mom and dad, mom and mom, whatever, if you have the same login, you can all participate. So you can manage multiple drivers. You can have different content for each of them depending on what their areas of difficulty are, what their priorities are. Short answer, yes, absolutely.
Okay. And is there a device that you can put on your teen's car to monitor their speed and driving abilities and obeying the traffic laws?
I know of devices where you can monitor their speed, and actually in Auto Coach, when you log each drive in order to get your to monitor how many hours you're doing, it will tell you their speed. So you can, but you'll be in the car with them, so you should be monitoring that as well. There are other devices, generally from insurance companies, that will monitor their speed. They're a little bit more big brother than Auto Coach is, and you can even geo-fence them in. There's other apps as well that I think you pay for, but they would be well worth the money in terms of setting high safety standards for your child.
Right. I use Life 360, and this is not a promo push, but I have a young driver. She's 18. She's been driving since she was 16, and it works. You can add additional resources on it, but I just have the basic one, and it's free. So I can, and even my son, wherever, he has an app on his phone. Even if he's in the bus and the bus driver goes over the speed limit, it alerts me. So it's really great.
Okay, great. And Haley, can you say the name of that program you just referred to one more time? There's a question about that.
Life 360. Life 360.
Great. Thank you, Haley. There are 2 questions in regards to the SAD grant. So the first question is, how does a group apply for the SAD grant? And then the second question that's related, for the nonprofit sector working in Atlanta, do you have to be associated with the school to start a SAD chapter?
So those are both easy questions. To get a SAD grant from GOHS, you have to go through an application process with us. Those applications usually begin in January. However, if you reach out to our office, we might still have additional funds this year. We're still trying to figure that out. So hopefully we do. If not, we would love to have you for 2022. Again, all of that should be on our social media as to when the applications open, usually sometime in January. And then for the nonprofit, as long as you're associated with a student group that is working with this school, so maybe if, I know we have a lot of people working in Family Connections across the state, that their Family Connection is their SAD group, but they work with the local high school. That might be something to think about as a nonprofit. Things like that, those are all good. We would love to have you again. Again, it's an application process, so we would love to fund everybody, but it is that application process. So that would be your first and foremost first step to do. If you don't want to be granted though, but you still want to be recognized as a SAD chapter, the SAD National Office has a portal that you can register your students on. There is a fee. That fee is covered through the SAD grant if you so choose to be part of our program with GOHS. So there's a multitude of different options as well.
Okay, and one last question. This person says that I have 2 15-year-olds and 3 13-year-olds. Any recommendation for parents like me? So Meredith, if I have not asked your question appropriately, please just add in more, but that's her question.
Prayer.
That's
Auto
You know what? Power of youth, power of youth. Have a conversation, dialogue, it helps with peer pressure and skill set, and it's absolutely free. This summer, log in, please.
I agree. There are so many great resources that are generally free and so many great organizations that want to help and want to do the right thing. Reach out. You can certainly reach out to any of us, but utilize those free resources. And maybe with that many kids, they'll peer pressure each other into driving safe. So
peer-to-peer education within the household. I like
within
that.
the family. Yes, yes. Good luck.
Yes, I agree. And one of our participants said that she is a foster parent. And so I give her so much credit, you know, in becoming a foster parent and working with these children and these teens. So that is just wonderful. I do have one more question, and that is for Stacey Tisdale, Ms. Tisdale. How do you mentioned with teens in the driver's seat that you work with youth and you do a peer-to-peer program. How do you do the peer-to-peer?
Well, what we do is, again, we're working with one group of teens within the school, middle or high school, and we give them resources. We give them a couple of boxes of stuff that they can utilize to do their messaging and activities. Along with that, we give them ideas that they can do throughout the year. So for instance, you know, we'll concentrate on impaired driving for a month and then distracted driving and so on. And it's just full of ideas for them. They can take those ideas and implement them themselves, or they can come up with their own activities and messaging, you know, utilizing the resources that we provide them. So the kits include, you know, banners, t-shirts, stickers, you know, all sorts of stuff that they can use, you know, to do informational tables, or if they want to do activities and give those out as prizes, then they can do that. So it's very plug and play, but it's also not so prescriptive that they can't do other things that they want to do within their school. Does that help? I hope. If not, again.
Yes.
I would also add that a number of my SAD groups also participate in Teens in the Driver's Seat as well. So they're a good program to kind of do a morphing of two peer-to-peer education programs as well.
Right. Yeah. Right. It's strictly on driving, and whereas SAD, they'll cover, you know, the red ribbon, you know, the drug use and things like that we don't cover. So yeah, it definitely is a good match.
And peer-to-peer tends to teach leadership skills along with
absolutely, yeah,
along with driving content, correct? I find it to be a very good method.
Oh yeah, and we've seen in, you know, the students that we've worked with, we watch them, you know, come from, you know, 7th graders on up to seniors, and just watching the way that they just blossom and bloom, you know, and they carry those skills with them throughout life, and also just the ability to be able to speak up and have that confidence. A lot of these guys, they don't know that they have the voices that they do, and people will listen to them, and all you have to do is that one statement of, I care about you, can you please put on your seatbelt? And you know, there's a lot of power in that.
NHTSA has also put out a great peer-to-peer education resource last year that did kind of an overview of a lot of teen activities that are out there right now. You can find it on NHTSA's website as well, but I can send it. It's a great resource. It just kind of does an overview of a lot of the peer-to-peer education programs that are out there currently.
That's a great resource, Katie. Thank you very much. Any other comments on the peer-to-peer?
I will plug National Association of Peer Program Professionals, NAPPP. They're out of St. Louis, and they have a website with a lot of resources and books and articles and all sorts of things. If somebody And you can actually do, you know, a peer education group within your school also.
Wonderful.
A lot of times the sponsors of programs have the students. So I actually train with the SAD chapters all the time. These are creme de la creme kids. You know, these are our future leaders, and they grow up and mature within the program. And so I've seen some of Katie's kids throughout the state now that are now in college, and they're taking on real leadership. So again, you know, nurses, you guys are like our first responders of these babies. And so sometimes we have to kind of reel them in, like especially if you got a bad kid that's going the wrong way, put them in a program. If they're not into sports, you know, put them into a leadership opportunity, and we have great programs out there to help them out.
And you all, I think we have time for one more question in the chat box. This question is, can you order the peer-to-peer education for a family to do within the home?
So our resources, it has to go to a school or it could be a group, so such as like a homeschool association group, but we need to work with a group of teens. However, we have a ton of information that is for the public on our website. So yeah, we've got, you know, information, posters, videos, all sorts of stuff on our website that anybody can go in and grab.
And again, that base is that peer-to-peer is the students teaching and helping their fellow students. So it's them really impacting each other versus a hierarchy of, you know, a teacher or a parent or a social group leader or something like that telling the kids what to do. It's more of them giving you the resources and then the students taking initiative and pushing it out to everybody else.
Great, thank you. Ashley, do we have any more questions in the chat box?
That's all. That's all the questions.
Great. First of all, I want to thank the panel. This discussion has been very helpful to all of us. And we'd like you, the participants, to please respond to the 2 brief poll questions that you will see on your screen. As you give feedback, will help us to improve our upcoming webinars. And also, it has been my pleasure to be your moderator today. If you would like further information about iPrice, please contact us at the email address that is listed on your screen. And I'd also like to thank our panel members. All 4 of you did an excellent job, and for taking the time to be with us today. Thank you very much, and we look forward to you coming back and joining us again soon.